So now we have Sarah in a relaxed reclined position. Janelle has actually topically applied a thin layer of hyaluronic acid serum. This is going to serve as a nice smooth gliding surface for the use of our micropen. As you can see, the micropen has no plugs or cords. It's lightweight, battery charged, rechargeable wand, and to it is attached the tip that contains the 11 needles that will oscillate in and out in order to create the millions of microperforations on her skin. So I'm going to get started now that her skin's been anesthetized on the surface. And as you can see, it's creating a certain light pinkish tinge, or what we like to call erythema. And that's evidence that there's good penetration of the needles through the upper layers of the skin. And in areas of increased concern, we like to see this kind of pinpoint bleeding pattern. And you can already see in the areas that we've treated, you have a nice pink tinge coming up, which is just evidence of good penetration of the microneedles. And that's the first part of the procedure, the microneedling. So now that we've created literally millions of microperforations on the surface of Sarah's skin, now we're going to take advantage of those microperforations and deliver Sarah's own platelet-rich plasma into those areas. So what I'm holding here is a vial of Sarah's own blood that was previously spun in a tabletop centrifuge. In this vial, there's a proprietary gel that accounts for the separation between what's called the platelet-rich plasma, which is the clear yellowish fluid on the top, or supernatant, and the remaining blood elements. So what we're going to do is draw this fluid off the top using a syringe and needle. Generally, it's within the range of about 7 or 8 cc's or milliliters of blood. And we're going to apply that to the surface of Sarah's skin and take advantage of the microperforations to soak this in. Now, the significance of this platelet-rich plasma is that it's enriched for Sarah's own stem cells and growth factors. This is extremely powerful because when it penetrates into her skin, it's going to jumpstart her own collagen, stimulate it to form new collagen, and her fibroblasts are the cells that produce that, and then that's going to repopulate her skin surface and enhance the skin color, texture, repair any irregularities that she might have. So that's why it's such a powerful procedure. So right now I have about 5 cc's, and there's a total of about 7. There's maybe another 2 cc's in it. And once again, this process can be applied to different areas of the body, neck, common areas, what's called the décolleté, or the V area on the neck that gets sun damage from wearing V-shaped necklines over someone's lifetime, stretch marks on the abdomen. It can be used to stimulate hair growth in areas of male or female pattern balding. What we use after our microneedling treatment is a series of products by Aven. Aven is a company that uses no chemicals, no irritants in all of their products and their derivatives. It's totally pure. So first of all, we start with the thermal spring water that Janelle's going to demonstrate. It's just applied over the skin surface, and Sarah's going to use that several times a day just to calm the skin and to create a nice, moist, hydrating environment for the microneedling. The second product is Hydrant's hydrating serum. She's going to apply that 2 to 3 times a day to the skin surface for added hydration. And the last element of the care package is what's called Cyclofate, which is a topical application that helps seal in moisture and prevent ongoing dryness and moisture loss. You can see it goes on very smoothly. That's the serum. It goes on clear and spreads very readily. And then the Cyclofate on the surface of that will help seal it in. Microneedling is appropriate for both men and women. It's a common question with males whether or not to shave. And what I tell my male patients is that if there's any issues related to the skin beneath the beard region, then by all means be clean shaven for the treatment. Some men do grow beards in order to conceal facial imperfections, and if those are areas of concern for them, then by all means the beard should not be there to facilitate penetration of the needles. If they keep the beard there all the time and not concerned, they can just leave the beard in place. It's basically dependent on whether there's issues beneath it that require treatment. Anywhere from 20s on, all skin types, dark skin, light skin, thicker, thinner skin. You just vary the depth of penetration based on the particular situation. You're going to feel a noticeable tightening of your skin, right? Leave the platelet-rich plasma on, let it penetrate. Tomorrow you can start with your normal cleansing regimen, and we're going to have you use a thermal water spray. It'll be a hydrating cream, and then a sickle fate, which will help seal in the hydration.
Very good.
All right.